Asthma is a condition in which your airways narrow and swell and produce extra mucus. This can make breathing difficult and trigger coughing, wheezing when you breathe, and shortness of breath. As shown here, there's many things that can trigger asthma, such as allergens, viruses, air pollution, food additives, drugs, occupational factors, emotional stress, cold air, and exercise. Vitamin C has anti-inflammatory and antioxidant properties, and this may benefit people with asthma. It's been proposed that vitamin C can reduce the oxidative stress placed on airway tissues, which in turn may reduce their hypersensitivity to common asthma triggers. A randomized control test in Nigeria examined patients whose asthma exacerbations resulted from respiratory infections. Vitamin C, when dosed at 1 gram a day, lowered the incidence of severe and moderate asthma attacks by 89%. The best form of vitamin C is intravenous. The best oral form, then, is liposomal vitamin C. Non-acidic vitamin C is the next best, with the worst form being ascorbic acid. Glutathione, the body's master antioxidant. It's a vital intra- and extracellular protective antioxidant against oxidative stresses, which can play a role in control of pro-inflammatory processes in the lungs. And results indicate that glutathione can modulate the early asthmatic reactions as well as the airway's hyperresponsiveness. Some of the best forms of glutathione are reduced glutathione at up to 1 gram per day, N-acetylcysteine at a dose of 500 milligrams 3 times per day, the herb milk thistle, and selenium is required by the body to make glutathione. 3 Brazil nuts per day supplies the recommended daily allowance of selenium. Magnesium sulfate is a bronchodilator. It relaxes the bronchial muscles and it expands the airways. This allows more air to flow in and out of the lungs. This can relieve symptoms of asthma, such as shortness of breath. Doctors mainly use magnesium sulfate to treat people who are having severe asthma flare-ups. Magnesium deficiency is associated with increased contractility of smooth muscle cells. Since contractility of bronchial smooth muscle is important in patients with asthma, magnesium deficiency could lead to bronchial smooth muscle contraction or lack of bronchial muscle relaxation. One of the best forms of magnesium is magnesium bisglycinate. As magnesium is required by hundreds of enzyme systems in the body, it can have profound benefits to health when taken every day. One of the best ways to determine the dose is to gradually increase it until you have stomach upset or diarrhea. Then reduce the dose until negative effects are removed. Then continue to take your maximum tolerable daily dose. Asthma is associated with aberrant mitochondrial metabolism. And secondly, mitochondrial dysfunction may either induce asthma-like features or increase asthma severity. And thirdly, mitochondria-targeted therapies appear effective in preventing or reversing asthma's features. Be sure to check out my other video on mitochondrial boosters. Increased oxidative damage in the lungs and poor antioxidant protection, including low levels of coenzyme Q10, can result in lung diseases like asthma and chronic obstructive pulmonary disease. Furthermore, it's been shown that people suffering from these conditions present lower levels of CoQ10. In studies on CoQ10, it was found that 300 milligrams per day was needed for a benefit to be noticed to endurance. This is one example of how important a correct dose is, as many companies sell CoQ10 that's only 30 milligrams per capsule. In another study for multiple sclerosis, 500 milligrams of coenzyme Q10 per day was used. Garlic has several health benefits, including anti-inflammatory properties. According to a 2013 study, because asthma is an inflammatory disease, garlic may help to relieve some symptoms. Researchers found that giving an oral vitamin D supplement reduced the risk of severe asthma attacks requiring hospital admission or emergency department attendance from 6% to 3%. They also found that vitamin D supplementation reduced the rate of asthma attacks needing treatment with steroid tablets. You can get a 25-hydroxy vitamin D blood test to assess your levels and then dose accordingly. There's evidence that vitamin K2 supplementation also reduces inflammation, and synergistically, vitamin K2 works with vitamin D. 300 micrograms per day is the maximum amount of vitamin K2 that your body will absorb. Therefore, more than this is not needed. Increased dietary vitamin E intake is associated with a reduced incidence of asthma, and combinations of antioxidant supplements, including vitamin E, are effective in reducing ozone-induced bronchoconstriction. Try to get a food-sourced vitamin E or a mixed tocopherol form of vitamin E instead of a synthetic form. Quercetin is a flavonoid that's naturally found in many fruits and vegetables, and it's been shown to exert multiple biological effects in experimental models, including the reduction of major symptoms of asthma, the bronchial hyperactivity, the mucus production, and the airway inflammation. Typical doses of quercetin are 500 milligrams twice per day. This is also used to help boost the immune system and prevent colds and flus. As it's a flavonoid, it works synergistically and enhances vitamin C's benefits also. Asthma is characterized by airway inflammation and airway remodeling. A previous study revealed that grapeseed proanthocyanidin extract could inhibit asthmatic airway inflammation and airway hyperresponsiveness by downregulation of inducible nitric oxide synthase in a murine model of acute asthma. Doses of grapeseed range from 100 to 300 milligrams per day. In relation to asthma, one study followed 77 participants with mild to moderate asthma who took curcumin capsules for 30 days. Researchers found that supplements help to reduce airway obstruction and could be a helpful complementary treatment for asthma. Doses of curcumin can be up to 5 grams per day. Curcumin's absorption, which is low, can be increased by using biopterin, which is a black pepper extract, or frying in an oil such as ghee, butter, coconut oil, or taking it with an omega-3 fish oil supplement. A 6-month study of children from Baltimore City by Johns Hopkins Medical Research has added to evidence that having more omega-3 fatty acids in the diet results in fewer asthma symptoms triggered by indoor air pollution. Typical doses can range from 3 to 9 grams per day of an EPA-DHA fish oil blend. Beta-glucans are sugars that are found in the cell walls of bacteria, fungi, yeast, algae, lichen, and plants, such as oats and barley. Findings suggest that the beta-1316 glucan can be used to decrease the symptoms of allergy in individuals with self-described ragweed allergy. Beta-glucan can be given orally, and it's typically less costly than immunotherapies and has much less side effects than the immunotherapies. A study demonstrated a reduction in asthmatic symptoms following beta-glucan administration. The reishi mushroom is a popular source of beta-glucans. Up to 9 grams a day of dried reishi can be taken. Used by Olympic athletes for its supposed energizing and oxygenating benefits, researchers believe that the cordyceps mushroom may serve as a useful anti-inflammatory supplement or a drug. In fact, cordyceps has been shown to reduce inflammation in the airways of mice, making this a potential therapy for asthma. In trials, 1 to 3 grams per day of cordyceps tends to be used. Panax ginseng is a medicinal herb that's been used to treat various immune diseases, including asthma and COPD. It was similar to an antihistamine in terms of improving the symptoms of rhinorrhea and nasal and eye itching, suggesting that a 4-week course of the ginseng was beneficial. Panax ginseng, though, is one of the most adulterated products, therefore only whole root should be purchased and not powders or capsules. Doses can be up to 1,000 milligrams per day. The anti-inflammatory effect of black seed oil may extend to improving asthma symptoms. Its effect in reducing inflammation in the airways may also help with bronchitis symptoms. This oil can be added to cooking. When it comes to asthma, you should eat to maintain a healthy weight, as being overweight can worsen asthma. You should aim to eat plenty of fruit and vegetables. Avoid allergy-triggering foods and avoid sulfites. So you want to eliminate also corn, wheat, milk, soy, and all foods with MSG, aspartame, Splenda, and all processed foods. And then you want to rotate your diet with suspected foods in order to find foods that trigger the asthma and make it worse.